Occupational health hazards, including orthopedic problems and those related to the radiation exposure, are well understood. In the past few years, the interventional cardiologists and doctors have been exposed to excess radiation from the fluoroscopic procedures. Due to such high exposure, they tend to have higher risk of developing brain tumors, skin cancer, thyroid diseases, and neurodegenerative disease. The doctor and physicians who spend years of their career wearing heavy lead aprons are more likely to be victims of long-term orthopedic back pain. Moreover, interventional operators involved in cardiac catheterization are more likely to develop musculoskeletal pain due to the use of lead aprons. And traditional lead aprons are usually of 0.35 or 0.5 mm lead equivalent, which does not protect enough area. Due to such adverse impact of heavy lead aprons, physicians and cardiologists are now looking for better protection from radiation. To get rid of such occupational health hazards, Safetec has introduced Aerosafe. Aerosafe is a unique radiation protection system that puts zero weight on the person wearing it, gives 1 mm lead equivalent body protection from shoulder to knees, and 0.5 mm lead equivalent protection to all the sensitive parts above the shoulders. As compared to lead aprons, Aerosafe is visibly weightless and gives better protection to a wider area of the body. Among doctors who work with fluoroscopy, hazards such as greater susceptibility to cancer and development of spinal disc disease are common. The currently available conventional lead aprons and thyroid shields do not cover the whole body of an operator. Moreover, the lead aprons are too heavy to be worn comfortably by the doctors during longer operations and surgeries that can take up to 2 hours or more if the situation is complex. Aerosafe reduces radiation exposure while eliminating orthopedic strain. It is an effective way to reduce radiation dose for occupationally exposed individuals. Aerosafe is a suspended radiation protection system that is available in mobile unit and ceiling-mounted configuration. This design puts zero weight on the back and ensures complete protection from radiation. Aerosafe reduces the likelihood of developing orthopedic injuries that may result from routinely wearing heavy lead aprons. This protection reduces total body radiation dose and cranial and eye exposure. A person can easily engage with Aerosafe. Aerosafe comes with a comfortable air waist that needs to be worn under the gown. This waist attaches itself to Aerosafe, which allows the operator to move freely within the workspace. Aerosafe is made up of an interconnected radiation-resistant material that creates a complete radiation protection environment for the operator. When you are done with the procedure, simply disengage with a single-handed action and put the system out of the way. When you need it again, simply reconnect it.
Aerosafe is a modern radiation protection system. Any dose of radiation is associated with high risks of cancer. The growth in utilization and complexity of fluoroscopic procedure has led to an increase in workload. Aerosafe is virtually weightless suspended radiation protection system that provides greater protection. Thanks to its ultra protection capabilities, it reduces 87 to 100% radiation exposure, resulting in healthier, happier clinicians. Aerosafe surpasses the partial radiation protection of conventional apparel. The lead acrylic head shield protects head and neck from radiation exposure. It prevents secondary radiation to the eyes in the form of scatter. Moreover, it protects cranial anatomy and provides freedom of movement, especially during challenging procedures. During a typical month of work, an interventionalist may receive more than the equivalent of 60 skull X-ray from unshielded scatter. Because Aerosafe move with the operator is always positioned optimally to protect the neck and head from scattered radiations. Aerosafe increase efficiency and effectiveness of treatment by eliminating workplace hazards and by allowing free movement within the work area. This approach to radiation protection has potential to enhance the safety and occupational health of medical personnel. Aerosafe is exceptionally user-friendly. You can easily wear the jacket under the gown to attach the body shield. The doctor can comfortably move around and look for the tools he required during the surgery. Moreover, he can also easily bend down while wearing the shield if he needs to. When radiation is no longer required, you can easily detach Aerosafe from your body, moving it out of your way. Maintaining sterility with Aerosafe is quite easy. Simply place the plastic in the centered position. Fold both the arm and sweep the corners of the plastic towards right and left arm of the suit sticking from the inside. Unfold the front to cover the shield entirely.
Aerosafe reduces radiation exposure, eliminates short and long-term orthopedic injuries, reduces risk of spinal disc disease as well as cost of doing business. A sterilized plastic drape allows the operator to frequently use the system without compromising sterility. Draping the Aerosafe is quite easy. Turn the sides in to form a nice U shape. Then fold both the sides to allow access to the drape. Next, we are going to place it in its dock. Insert your hand and place the drape centered. Starting from right, pull out and unfold pockets. Now remove the sterile cover from pouch, open it, and look for first hand symbol. Insert your hand and place the drape centered. There would be an upward and downward sweeping motion. See? You go down and up like this, placing the piece of Velcro on the upper corner and inside piece on the opposite. Same things happen on the other side. Insert both hands in the pocket and open. Same sweeping motion, sliding down, then up, placing the Velcros on the uppermost corner. At this point, we have the drape fixed to its front. Now we are going to unfold the front to cover the whole body shield. Starting from the right, you have to grab this corner, grab inside from here, and move towards the other side to slide both corners up and over. Same thing on the other side. Pull this corner out and move it slowly towards the inside to slide it up and over. Insert your hand in the pocket and place it on internal Velcros. Now unfold the flaps and you are good to go. Hello everyone, my name is Dr. Calvin Morris and I'm a professional surgeon. I've been working as a surgeon for the last 7 years. Today, I will discuss about the harmful effects of radiation and how to protect ourselves in the best possible way from such cancer-causing rays. To start with, radiation is the emission of energy as electromagnetic waves or as moving subatomic particles, especially high-energy particles which cause ionization. According to numerous researchers, radiation from X-ray machines, CT scans, gamma camera, etc. increases a person's risk of developing cancer later in life. How soon a person develops cancer depends on the intensity of exposure during a time period. For instance, there has been a case where a 60-year-old man developed cancer in just 6 months and died in 7th just because he spent most of his time relaxing and working in X-ray room, which had no radiation protection mechanism. During my house job, although I had nothing to do with X-ray and CT scans, developed chronic respiratory problems and skin diseases as my cabin was next to the X-ray room without a radiation protection shield. At this time, lead was being used intensively in all major hospitals as radiation protection shields, so I requested the administration to protect the room with lead. After 3 to 4 years of installing lead, we figured out that radiation is not being completely absorbed. There was a major leakage which was harming the hospital staff and patients. This simply means that the purpose of installing lead has been killed. We were in a state of confusion and helplessness when a team of Safetec approached us. They introduced race shield room protection that is available in both tiles and powder form. Their installation method is quite simple and does not create mess. They claim that race shield absorbs at least 97% of the radiation and its life stretches to more than 10 years. We asked them to show us proof that race shield absorbed 97% of the radiation, unlike lead, and they did. They conducted a test with dosimeter in front of us that showed how much radiation is being absorbed by both lead and race shield. Moreover, disposing of lead is difficult as it is toxic. It has been 3 years since Safetec has installed raised shield in our hospital, and we never had any complaint about anything. To this date, there is no official cure for cancer. Kindly act responsibly and install raised shield to ensure maximum protection for X-rays and gamma rays. Have a nice day and stay safe. Cheers.